Melzer, Vice President of Actions and Programs for Charlottesville Now. Thank you for joining us tonight for our program, Life After Roe. After the Dobbs v. Jackson decision and the devastating, if not unexpected, reversal of Roe v. Wade, we are all struggling to deal with the after effects. Women and their medical providers are living in a state of confusion and fear with the many and often punitive new anti-abortion state laws. 17 states have an abortion ban in effect now. 1 in 3 women now live in a state without abortion access. Here in Virginia, where abortion is still legal for the moment, we are determining the effects it will have on our state. We are so fortunate to have Dr. Chisholm, a nationally recognized expert in maternal and fetal medicine at the UVA Medical Center, to discuss how these abortion bans are affecting the practice of medicine and the best care for women. We also welcome Mix-Han Jones, Political Director of Planned Parenthood Advocates of Virginia. And so on to the program. Our first speaker tonight is Dr. Chisholm. He has been a member of the Division of Maternal Fetal Medicine at UVA Medical Center since 2002. He currently serves as the medical director for outpatient clinics and for labor and delivery, as well as the department vice chair for medical education. He has served as the chair of the Virginia section of the American College of Obstetricians and Gynecologists. He completed his medical education and residency training at the University of Maryland and his fellowship training at the University of North Carolina. Thank you so much, Dr. Chisholm. If people in the audience, if you have questions for him, please enter them in the chat field. Thank you.
Okay, well, thank you very much for that kind introduction. And thank you to the organizers for the opportunity to join this evening. It's an honor to be with you this evening and to address an issue of importance to all of us. Before I begin, I would like to just humbly acknowledge a couple of things. The first is that I am male, and I am male in a field that has long been excessively dominated by men and where men have exerted control. I think I have tempered that by choosing a career where I've devoted myself to women's health. I am white, and I've not experienced systematic disadvantage in the healthcare system or elsewhere. Lastly, and maybe most directly related to this evening's topic, I have not had to personally face the decision about ending a pregnancy, but I've cared for enough patients in that difficult time to understand a little bit about what they experience. As was mentioned, I am involved in medical education, and I promise I'm not going to give you a lecture, but I do have a couple of slides to share just for a little bit of context and background. So we tested the share, and it seemed like it worked. So I'm going to go ahead and try again. And if somebody can please verify that right now you're able to see a full screen view of a slide, no presentation view or anything else like that. Perfect. So my specialty is obstetrics and gynecology, and my subspecialty is maternal fetal medicine. And so I trained for 4 years after medical school in the care of women's health, and then chose to subspecialize in the care of women with complicated pregnancies. So the people that I serve, the people that I care for, are patients who have serious medical conditions, which may be seriously compromised by pregnancy, patients who learn that they have fetuses with severe anomalies, and people who experience complications during the pregnancy that may threaten the health of the mother, all of whom may at one point or another face a choice about continuing or not continuing a pregnancy. That is completely separate from the population of people who may find themselves in the situation of an unintended pregnancy that does not come at a good time in their life, and they want to have the ability to choose not to continue with that pregnancy. These are some slides from the CDC showing statistics. Our national statistics system, unfortunately, usually lags behind by about 2 years. So this was published in November of last year, reporting 2019 statistics and showing trends over time. The solid brown line shows the total number of abortions performed in each of the calendar years from 2010 to 2019. And you can see there's a little under 800,000 in 2010 and a little over 600,000 in 2019. The longer dashed line is the abortion rate. And this is the number of procedures performed per 1,000 women aged 15 to 44. And you can see a bit of a downward trend as well over time. Importantly, there's a wide range. And if you looked at the tables, which I did not put into this slide set, divided by state or geographic area, you would find that this ranges from a low of 0.3 per 1,000 women to a high of 27 per 1,000 women. And then lastly, the dotted line at the bottom is the abortion ratio, which is the number of abortions per 1,000 live births. And this, again, varies widely across our nation from a low of 5 per 1,000 to a high of 472 per 1,000. And I think the last comment that I have on that slide is sort of interesting in this era. This is 2.5 years before the Dobbs decision, when in some geographic regions, up to 70% of abortions being performed were to someone who resided in another state. I think we will absolutely expect to see changes in that number as people have no option but to seek abortion out of state. This next slide shows just a breakdown for the 2019 statistics of gestational age range when abortions are performed. And you can see here that the overwhelming majority of abortion procedures are performed in the first trimester prior to 13 weeks of pregnancy, with the remainder performed at 14 weeks or later. And there's a wide variability in the upper gestational age limit at which abortion is considered legal. The cutoff in Virginia is interestingly worded. The statute states that abortion is legal until the end of the second trimester. Pregnancy is 40 weeks long. So if we divide that, that's 26 weeks and 6 days or 5 days or something like that. However, it goes on then to specify that a trimester shall be defined as a 12-week period of pregnancy, which cuts some time off. So most people interpret that as meaning 24 weeks in Virginia. The percentages look small, but in fact, the raw numbers out of the 600,000 plus abortions performed in the United States in 2019, over 20,000 of them were performed in this 15-week or later period. And I point that out because that's become one of the sort of hot button issues in the discussions occurring from one state to another, is the whether or not there should be a lower gestational age limit than what is currently legally allowed. I would point out that in the group of patients that I and other maternal fetal medicine subspecialists and other OBGYNs care for, that gestational age, that time period is really important, because that is the time in pregnancy when someone with, say, an underlying severe cardiovascular disease or pulmonary disease, a woman with a history of cancer who experiences a recurrence, the gestational age when ultrasound or other testing may identify fetal anomalies, and when some serious complications of pregnancy can begin to occur. That's a really important time period for abortion to be available and safe and legal. Just a couple of little statistics for Virginia, and this compares 2019 to 2020. These are some data from the Guttmacher Institute as well. You see there was an increase in the total number of abortions performed in Virginia in 2020, and the rate went up a little bit. The proportion to non-residents was relatively low. Most of them occurred in women aged 20 to 35, which makes sense because that's most women who are having pregnancies. And most occurred, more than half occurred in women who have never before had an abortion. I think these statistics in Virginia are very telling. Only 16 clinics across the entire Commonwealth where abortion is available. 93% of Virginia counties do not have even one abortion provider, and 80% of women in Virginia reside in a county that does not have at least one abortion provider, which poses a barrier to access. This map comes from the Guttmacher Institute as well, and is sort of a heat map showing the variability across the country from the only dark blue state, Oregon, with what they have judged to be the most protective environment, to the dark red across the Southeast and elsewhere, with very restrictive laws. And this map may sort of change continuously. West Virginia just sort of flipped from a less dark color to this dark red with the passage of their legislation last month that essentially completely banned abortion in West Virginia. This does not take into account specifically criminal statutes, although that is one of the methods that's being employed in a lot of states with restrictions, is not just barring abortion, but instituting criminal penalties for either women or physicians or both for performing one or receiving one. Last two slides, really. And this is, what are we trying to do about it? Well, ACOG, the American College of Obstetricians and Gynecologists, is the main professional medical organization for women's healthcare providers, with over 60,000 members. I have served as an officer in the organization at the state level. Very proud of my membership in this organization. And ACOG has really tried to lead the legislative efforts, not just on abortion, but to try to advance women's health in all aspects to the forefront. And in July of this year, shortly after the Dobbs decision, issued a statement which 75 other healthcare organizations signed on to. And this wasn't just women's health organizations. This was the American College of Physicians, the American Academy of Pediatricians, anyone who advocates for a group of patients and their access to be able to receive care. And this slide is kind of busy, but I think there are a couple of things I just wanted to kind of read out of it, that I bolded, that highlight the content of this statement. Oppose all legislative interference in the patient-clinician relationship. Our patients need to be able to access, and our clinicians need to be able to provide evidence-based care that is right for them, including abortion, without arbitrary limitations, without threats, and without harm. And then secondarily, patients form trusting relationships with their healthcare professionals. But when healthcare professionals are prevented from providing the full spectrum of care by threat of legal action, the quality and scope of care they can provide is limited. And it goes on, there's more detail to it than that. That the entire statement is available on the public side of the ACOG website, www.acog.org, for anyone who would like to read the entire statement. So I promised I wasn't going to have a lot of slides. I'm not giving a lecture, but I just wanted to make a couple of other comments before we do questions. I do not believe that the tactics that are used to try to introduce restrictions are really helpful or appropriate. Many legislators will say, well, I support an exception for cases of rape and incest or serious maternal health conditions or threats to the mother's life. Well, that in essence is a form of rationing healthcare. It implies that one person's circumstances of facing a decision about an abortion are more important or more compelling than someone else's. They're arbitrary and they're inequitable. And it implies judgment that we're not in a position to make. Setting gestational age limits is another popular tactic. Let's set a cutoff, and 15 weeks has become very popular based on some bad science addressing, related to when a fetus may or may not experience pain. And there's good science that 15 weeks is not when fetal pain can be experienced. But as I mentioned, a gestational age limit of 15 weeks or even earlier seriously disadvantages patients who may learn only later in the pregnancy that there's been a fetal anomaly diagnosed, that the mother has either developed or has experienced worsening of a serious medical condition, or has had a complication of pregnancy. And we've heard a couple of these stories since before Dobbs, I mean, since the Texas restrictions were passed a year ago of women whose water breaks at 15 or 16 or 17 weeks of pregnancy, which is a situation that in all cases, 99+% of cases does not result in a live birth. But the physician's hands are tied and they cannot begin the process of inducing labor or helping the patient to end the pregnancy, literally until the patient is seriously ill. And they can say with some amount of medical judgment that their life is threatened. Legislative restrictions on access to abortion opens the door for other legislative intrusions into the patient-clinician relationship. And I say patient-clinician because not everybody sees a doctor for their healthcare. They may see a nurse practitioner, they may see a midwife, they may see a physician assistant, but they value that relationship. And the phrase ACOG used for a long time was keep the legislators out of the exam room. That legislators are neither educated nor trained to be able to make healthcare decisions. And last time I checked, nowhere in the US Constitution or the Constitution of any state does it include an obligation of citizenship to surrender your bodily autonomy to the state. One of the things that we have faced and I think troubled by is the pendulum. We have we elect officials, governor, legislators who want to restrict access to abortion. They pass a lot of laws. We saw this under three administrations ago, under Governor McDonnell. And then we work and work and work to change the political climate and elect leaders who will remove those restrictions and try to base the decisions on science rather than on non-science. And then it swings back and forth. And people's lives shouldn't depend on who's in office, right? People's ability to make a healthcare decision shouldn't depend on who's in office. The last comment that I really wanted to make is about the impact that these laws are having on medical education. One of my significant roles is in teaching medical students and residents in OBGYN. And every year I serve as an advisor to several medical students who are in their final year and are in the process of choosing where they're going to go for their OBGYN training. Now that's a stressful enough process because OBGYN is a very competitive specialty. We are very, very fortunate to attract the very best medical students, smart, idealistic, hardworking, dedicated people who want to make women's health better, who want to reduce healthcare disparities, and don't want to compromise on those things. And this year, for the first time, in the process of that already very high stress, high stakes process, all of them had to take into account where they might match for their residency. Now, if you're not familiar with it, the residency matching process is not something where you interview some places and you choose where you want to go. You interview some places and then a computer tells you where you're going. And I've had several advisees this year who have said, I don't want to end up in Texas. I don't want to end up in Mississippi, Oklahoma. And so they're choosing not to interview residency programs in those states because they don't want to compromise any aspect of their training. Now, what is that going to do for women's health in those states remains to be seen. It's interesting that the states with some of the most restrictive laws surrounding abortion are also the states that have not expanded Medicaid to cover pregnancy, have not expanded Medicaid to cover the full 12 months after pregnancy ends, have the highest rates of maternal mortality, and have the worst racial disparities in women's healthcare outcomes. Now, that's not a coincidence, right? Physicians are even thinking about leaving states. Physicians who are already finished training are thinking about leaving states if the legislature enacts restrictive laws. That's just going to be another thing that contributes to unequal distribution of healthcare providers for women and worsening of women's healthcare outcomes in those states. A number of years ago, I had a neighbor who had still the best bumper sticker I've ever seen. On the back of their car, in their bumper, it said, If you're against abortion, don't have one. In other words, let people make their own decisions. Let people make their own decisions, but don't make my decisions for me. So I thank you very much for the opportunity. I hope my comments have been interesting and helpful, and I will be happy to start trying to field questions. And I don't want to cut into Han Jones's time, so I will try to be brief in my responses.
Well, thank you so much, Dr. Chisholm. There are a couple of questions in the chat. Virginia Doherty asked, where did that erroneous idea about fetal pain come from?
I don't know where it came from, but one of the things that when I was an officer in the Virginia section of ACOG, at the end of during the implementation and through the period of the very restrictive laws surrounding abortion, including informed consent laws, mandatory ultrasound, the only thing they weren't able to attack was gestational age limits. And this was one of the cases that a number of organizations used. Now, we can find plenty of good scientific study that shows development of neural pathways that are required to feel pain don't appear until late second, even early third trimester of pregnancy. So at the gestational ages we're talking about, 16, 18, 20 weeks, there is no concept of fetal pain, partly because there is no consciousness. And consciousness is necessary to experience pain. But where it originated, I don't know.
Right. And Elizabeth Alcorn asks, what problems are you hearing from the physicians practicing in states where abortion is banned, which I think you were kind of
Fear of legal consequences. I was at a conference 2 weekends ago that included ACOG member physicians from all over the Southeast and sort of a swath of the West out towards like Missouri and Kansas. And Tennessee is the most restrictive and has criminal penalties. It is essentially impossible to receive an abortion or for a physician to talk to you about an abortion in the state of Tennessee. West Virginia is very close behind Tennessee. But there's a real fear of what is going to happen to me if I talk to this person, if I answer their questions, if I try to give them medical advice that I know is sound and based on my medical knowledge. Many of them are even developing a relationship with a criminal defense attorney. So if someone decides to file criminal charges against them, they have a plan in place for how to manage that. People are thinking about leaving the states where they're practicing. West Virginia can't afford to lose OBGYN physicians. It's already underserved.
Right. Also, Elizabeth is asking if the ACOG is filing lawsuits to protect the doctor-patient relationship.
That's a great question, and I don't know specifically. I know that they have filed many what are known as amicus briefs, which are legal briefs basically filed in support of another organization that has attempted to file like a challenge to a law that's been passed. Because it's a national organization, they can't necessarily operate individually at the state levels, but they can support others that are working to change things at the state level.
Thank you. I know Jan is asking, and I think Han can talk about this more. Part of what I think we're facing is how to talk about this to, appeal to more people about how necessary this is. And that's what Jan is referring to. She said, when anti-choice folks say that abortions are being performed up to 40 weeks, pro-choice politicians are making very weak arguments to counter this. In her opinion, but please help us make a stronger argument against this falsehood, which, by the way, your statistics are really, I think that was very helpful. But if you have any ideas of how we could talk about why this is important to not put a gestational age, maybe you could answer that.
Yeah, well, I first of all, I appreciate the selection of the term anti-choice. That's the term I like to use as well. Because it isn't pro-life, it's anti-choice, and it's about control. There are a couple of states that allow late terminations of pregnancy. And they're all very specific in the conditions under which it's necessary. And it usually is for a fetus that's been diagnosed late in pregnancy with a lethal anomaly, and where the family is making the choice to end the pregnancy at the time that it is diagnosed, rather than carry the pregnancy to term and deliver a baby that they know is going to die or is going to suffer and then die. And I don't know the specific gestational ages, but I do know that there's a clinic in Maryland and there's one in DC, and I think there's maybe Colorado, where you can go in the third trimester, like as late as 30 or so weeks, and still have an abortion performed. There used to be a clinic in Kansas where you could do that until an activist assassinated Dr. Tiller in his church, no less, for his stance on abortion and for performing abortions even late in pregnancy.
I feel like we didn't take that serious back then, and now we're facing even more crisis. Actually, C. Davis, and then I think we're going to move on to Han because I know she has to get going. So the ACOG site press releases have lots of thoughtful and compelling ways to discuss. So let's all check that out later.
Yeah, there's an entire page on ACOG that is all publicly available. I mean, they have additional resources that are only available to members, but if you click on the abortion is healthcare link on their main page, you get access to all of the stuff that they have, and they update it regularly.
Actually, this is a great, I totally agree with Cindy. Cindy Jane Child just said that she's worried that the expansion of the word of abortion, for example, the treatment of an ectopic pregnancy is now described as an abortion, or the situation when there is a fetal demise, the scope of abortion is being expanded to medical care for women's reproductive issues. And she's right, actually. Could you maybe talk tiny bit about that, 2 minutes?
Very tiny bit. Very
Yeah, that's about education. And I will tell you, it can be done. Alabama, of all states, has written, I mean, their gestational age restrictions are a problem, but the way that they have defined conditions under which nobody even has to ask, it's okay. And that, like, they defined in there ectopic pregnancy and a bunch of other things, that it clarifies it in a way that is medically sound. And so it's about educating the legislators and getting them to do that.
Or just don't put any restrictions. Thank you so
Or just
much.
don't put any restrictions, but if there are going to be, make sure it's defined well. Thank you all very much.
Thank you.
Thank you very much, Dr. Chisholm. And I don't want to rush you. And if you can be around a little bit longer after Han finishes, maybe people have other questions for you. But if we can turn to Han. Speaking next is Mix Han Jones, who has been working in political campaigns in Virginia and across the country for the last 6 years, with the goal of electing progressive leaders who will serve as reproductive rights champions. Han earned their BA and MA from Brown University, studying gender and sexuality, public policy in American institutions, and behavioral and social science interventions. They are proud to be an organizer at heart, have gotten their start in politics as an organizer as part of the 2016 and 2017 elections in Virginia. Han has also managed campaigns and political programs in Virginia and beyond. When Han is not engaging in political work, they enjoy traveling, cooking, spending time with their partner and dog, Ella. Han, thank you so much.
Thank you so much for having me. I'm really excited to be speaking with you all. I know many of the people on this call from way back when at this point, and I'm really excited to get to join so many of my friends in Charlottesville to talk about these important issues. As Kathy said, I am the political director with Planned Parenthood Advocates of Virginia. I always like to start with a disclaimer. I am not a doctor, nor am I a lawyer. So I'm always really happy when I get to speak alongside a provider like Dr. Chisholm. Thank you so much for your work. And I do want to start by addressing something that was said. I want to be clear, ectopic pregnancies, what you do get after an ectopic pregnancy is absolutely an abortion. And we actually need to use the word abortion a lot more. And you're going to hear me say pro-abortion rights. You're going to hear me say the word abortion a lot. because an abortion is a medical procedure, and we should not act like it's something that's scary or something that's bad or shameful or harmful. It is a medical procedure that is in many cases life-saving. So I'm going to be using that word a lot. So I want to talk about a few things. First, I want to talk about what we're seeing with the abortion bans. I know there are a lot of questions about what we are seeing at Planned Parenthood with all of these bans happening. I know there's a lot of concern. There's a lot of questions. First of all, and I want to always double click on this, abortion is legal in Virginia. And without a lot of the onerous restrictions that are faced in other states, there are no waiting periods, there are not mandatory ultrasounds, a lot of trap restrictions that had been in place got removed. We have the Reproductive Health Protection Act to thank for a lot of that, which was just an absolutely wonderful piece of legislation that I think we're all very thankful for right now, that made it so many of those restrictions are gone. We're also incredibly lucky that, like Dr. Chisholm pointed out, we are a state that does allow nurse practitioners, certified nurse midwives to perform abortion care. That is not true everywhere. So that's something we should be really thankful for. In other states that are not Virginia, I know a lot of people are curious about if Planned Parenthood is going to start closing their clinics, what we're going to do now that we have these states that are banning abortion. I want to be 100% clear that Planned Parenthood is not closing their clinics. For one thing, while abortion care is incredibly important and something that we are proud to offer, it's only actually about 3% of Planned Parenthood services. So in places where abortion is no longer legal, there's still a lot of work to do where contraceptive access, Planned Parenthood is a leading provider of gender-affirming care for our trans populations who need help, as well as prenatal care, postnatal care. Here in Virginia, we do primary care, vasectomy services as well. Planned Parenthood is not just for women. Always like to make that clear. So absolutely, Planned Parenthood are going to continue to exist and is not closing down their clinics. Now, I should say Planned Parenthood is able to stay open. We have seen that a lot of clinics are closing in some states that are not Planned Parenthoods. For example, there is something that they're noticing that clinics are closing more in Iowa, and we're actually already seeing that STD rates have started rising, possibly as a result of those clinics closing, because a lot of places that do offer abortion services do STI screening as well. And a lot of what's happening and what we're seeing is reports about people already having a hard time accessing care, especially for things that are medical, like miscarriage management and ectopic pregnancies. Like Dr. Chisholm said, some states have made it so there are exceptions for those things. Not all have. And that's for those that do not know, ectopic pregnancies are life-threatening. There was recently a poll done that showed that the majority of men in this country believe that ectopic pregnancies can just get pushed into the uterus. I want to be 100% clear. That's not right. That's just not how any of this works. So I want to be clear about that. I know a lot of people are also curious about what folks in those states are doing. How are people in banned states getting the abortion care that they sometimes need? And that's really varying. We are not tracking self-managed abortion because it could be very harmful for the people who are self-managing their abortions. And I'd like to be clear, we like to say self-managed abortion, not illegal abortion. Self-managed abortion just means an abortion that a person is managing themselves without a medical situation, which in early pregnancy can be incredibly safe if there are not complications. So we know that is happening. We know that sales of abortion pills from Plan C have gone up since the fall of Roe. It's impossible for us to know how much of that is people stockpiling and making sure they have that in a case where it gets even worse, more criminalized. But we do expect that. We also are seeing a lot of people traveling, a lot of people. I can tell you in North Carolina, which does have a lot of restrictions on the books, 20-week abortion ban, in addition to a waiting period and a couple of other trap restrictions in North Carolina. But North Carolina being, because in Florida there is a 15-week abortion ban, South Carolina has a 6-week abortion ban, but it's been blocked in the courts right now. And Georgia also has a 6-week abortion ban. North Carolina, for many people, and like Dr. Chisholm said, Tennessee, not a place that you can get an abortion at all. West Virginia, not an option. Kentucky, not great. Like there's a lot of these restrictions. So a lot of folks are going to North Carolina. In fact, a third of the patients they're seeing in North Carolina, abortion patients, are from out of state. And I want to talk a little bit about what that means. Because for a lot of people, it's like, oh, great. So we're set. We'll just go to North Carolina. That's something that's actually takes a lot of privilege to be able to do in the first place, especially when we're looking at things like waiting periods. Because a lot of people, and this is something not often talked about, I think there's a picture that people have of an abortion patient who is, 18 or 19. That's not necessarily true. A lot of abortion patients have children. Childcare can be incredibly expensive in the United States. So when you're looking at someone having to take time off of work, travel, get childcare, maybe stay in a hotel, this can be incredibly expensive, and very difficult for a lot of people of color and lower income people that are in the Southeastern United States. And North Carolina could lose their abortion rights in the coming couple of months, while very luckily, Governor Cooper, who is the governor of North Carolina, will be there for 2 more years, and he is unabashedly pro-abortion rights. They are very, very close to a Republican and anti-abortion supermajority that would allow them to override the vetoes that the governor has been using liberally to keep abortion rights legal, to keep voting rights in North Carolina. So there's a lot at stake. And if North Carolina's abortion rights do get even further eroded than they already are, Virginia is kind of it. And that's really concerning. Already, Virginia is seeing some patients from out of state, but North Carolina has definitely absorbed a large brunt of that. In North Carolina, in certain areas, they're already seeing waiting lists for abortion rights up to 3 weeks. This is time-sensitive care. A lot of folks do not want to wait 3 weeks for their abortion care. And that's really important, that folks are able to access that care in a timely fashion. So I'm really hopeful that North Carolina is going to stay a place where people can get abortion rights, so we don't get quite so overburdened here in Virginia. We, like Dr. Chisholm said, there are not actually that many places in Virginia that you can access an abortion. So if everyone in the entire Southeastern United States is trying to come to Virginia, that is not actually a very good solution. And I do want to talk about, with these expenses I'm talking about, abortion funds. And I know Blue Ridge Abortion Fund was not able to make it tonight, but they are incredibly important, especially now. These, not only can an abortion be very expensive, just the procedure, but everything that can go into getting somewhere to get that abortion, to get the time off, to get that child care, can be incredibly expensive. And organizations like Blue Ridge Abortion Fund have done a fantastic job of making sure that people have the help that they need. So right now, Virginia is great. We should be very concerned, even here in Virginia. I know a lot of folks have probably heard me yell about this before, but our governor is unabashedly anti-abortion in a very frightening way, and has in fact already appointed 4 legislators whose job it is to bring an abortion ban to the legislative session this January. We should all be really worried about that. The House of Delegates is currently in a Republican majority, and not only that, but on legislation that was introduced last legislative session, in the House of Delegates, both pieces of anti-abortion legislation that made it to the floor passed the House of Delegates on a party line vote. One of those was a bias counseling bill, which basically requires providers to tell certain things to their patients before they get a procedure. That is not normal. Normally, providers can decide what information patients need because they are doctors, not legislators. And that is really important to not have. We are lucky that we were able to kill that in the Senate committee. There was also a so-called Born Alive bill. We see a lot of these bills. These bills are basically ways to threaten and criminalize providers using kind of bad science. And that was introduced by Delegate Nick Freitas, who some of you may be familiar with. And luckily, we were able to defeat that legislation in the state Senate because we do have a Democratic majority, 21-19. Now, the problem is that on reproductive rights, abortion rights, we have a 2020 tie. One of our Democratic state senators, my state senator, fun fact, actually introduced a 20-week abortion ban with Senator Amanda Chase just last session. So we know where he stands and where he would be likely to vote on that issue. If there is a tie on the Senate floor, the tiebreaker is the Lieutenant Governor, Winsome Sears, who said while running for office that she would support a 6-week abortion ban, similar to the one we saw in Texas, being passed here in Virginia. So we're really hanging by a thread. The only reason that we've been able to keep abortion rights is being able to kill things in Senate committee. And that is not a guarantee. And we need to ensure that we are doing everything we can. The elections that are coming up in 2023, and in 2022, all of the elections, very important, because since the overturn of Roe v. Wade, we don't have the protections we used to have. And the long-term goal, I think what we should be looking at long-term is a constitutional amendment that would codify the right to an abortion. Now, that's a long journey. So I'm going to ask you to stick with me on this because this gets a little wonky. We would need to get a constitutional amendment, it needs to pass the legislature, both houses of the legislature, in Virginia, I'm talking about. I would love a United States one. That's way harder, just because of everything that has to be done to ratify it. And I think we can do Virginia a little faster. So in 2023, we would need to win a majority in the House of Delegates and get a much stronger majority in the state Senate, because I have a bad feeling that at least one of our Democratic state senators is not going to vote for codification of abortion rights. So we would need to have a big win in 2023. Then we would need to lobby and make sure we got that constitutional amendment passed. And then we would need to win again in 2025 and make sure we kept the majority in the House of Delegates, because it needs to be passed twice with an intervening election. So basically, people need to have the right to vote out people who did something they don't like before it can be passed again. So let's say we pass it in 2024, 2025 elections, we win, we pass it again in the legislative session after that, then it would go on a general ballot in 2026. I am very confident that a constitutional amendment here in Virginia codifying abortion access would win on a general ballot. Now, why do I feel that way? Because it won in Kansas. And if it can win in Kansas, it can definitely win here. Kansas is not exactly a progressive bastion. But even so, that when they proposed a constitutional amendment that would have removed the right to an abortion from their constitution, it was defeated by 18 points in Kansas. So that is our long-term goal, because until that constitutional amendment is in place, every single election, every time our legislature or our governor are up for election, our abortion rights are at risk every single time. And I would love to believe that an anti-abortion person will never win the governorship or either legislative body ever again, but that might not be true. So we should definitely be counting on a longer term protection. I also want to say that when we see this abortion ban, it probably is not going to be a total abortion ban that everyone is immediately like, oh no. There have been a lot of anti-abortion folks framing the 15-week abortion bans, the 20-week abortion bans we're seeing as compromises. These are not compromises. It is not a compromise for politicians and laws to be interfering in a patient's relationship with their medical provider ever. That is never a compromise. And I've been asked questions about, well, up to what week should things be legal? Up to what week? And here's the thing. We don't legislate most healthcare the way we legislate abortion. We allow people to consult with medical professionals who go through a lot of education, and allow them to make the decision that makes the most sense for them. And that's what we should want here in Virginia. It is a person's decision to make with their loved ones and their medical provider. So how do we protect our right to abortion care here? What does that look like? It's voting, it's getting involved in elections. I know for a fact that some of y'all knock doors and make phone calls. Please keep doing that. Keep being involved, keep working really hard for this. And again, I really can't stress enough how important what we're seeing in North Carolina is this year. And we know that a federal abortion ban was introduced by Senator Lindsey Graham recently. And that was really interesting because what they had been saying is, well, we just want states to be able to decide for themselves. But very quickly after Roe v. Wade was overturned, they showed that that wasn't really the goal, because they're trying to pass a federal abortion ban. And if we wanted states to decide, they probably would let states decide. So federal elections matter too. But I know folks generally do turn out for midterms for presidential years. I know folks do turn out, and we see a huge drop off in Virginia for our off-year state Senate and House of Delegates races. I can't stress enough that those races actually have the most impact on your rights, your bodily autonomy, whether or not you can get an abortion. And that is really important. And access is really, really important too. We talk a lot about legality, and we don't talk as much about access. Access is really important, and legality does not necessarily dictate access. Just because abortion is legal does not mean everyone can get an abortion who needs one. Because of the Hyde Amendment, which I don't know if anyone here is familiar with the Hyde Amendment, but basically it restricts funding for abortion, federal taxpayer funding for abortion. And what that means is that a lot of folks on Medicaid cannot access an abortion. And that's a really big problem. In addition, we know that people of color, lower income people, already have barriers to receiving healthcare. And we know that Black women are almost 3 times more likely to die as a result of pregnancy. And that's really concerning. So this absolutely is a racial issue as well. This is an equity issue. This isn't just one right. This is about what's going to impact a population. So I just talked a lot. So I'm going to stop. I see a question. Did you say that nurse practitioners can perform abortions in Virginia? Yeah, there are nurse practitioners who can provide abortion care. In a lot of cases, that's first trimester abortion care. And to be 100% clear, because I think there's a little bit of confusion about what abortion care looks like. In a large percentage of cases, abortion care looks like a person taking a pill, and is not what sometimes anti-abortion politicians would like to frame it as a very, a procedure of dismemberment or whatever. It's overwhelmingly not the case. And there are people in other states who can be licensed to deliver a baby who cannot provide first trimester abortion care, which is just kind of wild to me. But yeah, are there any other questions about any of those things I talked about or anything else? I know that people might be typing, so I do want to just, oh, sorry, I just see one pop up. What do we need to do this year? Well, I know there are some very competitive congressional races here in Virginia. I hope folks are getting involved with those, especially some of our folks in Virginia Beach in particular. That's been a really, really contentious race. We have Abigail Spanberger is running against Yesley Vega, who believes that women can't get pregnant from a rape. So that's fun. That's an interesting fact. So if you all are interested in getting involved in those races, I do recommend it. I'm also just dropping a link tree to all of our 2022 electoral efforts, including we will be doing a lot of stuff, recruiting canvassers in North Carolina, doing phone banking for North Carolina, trying to get the word out to folks in North Carolina just exactly how at risk their rights are. I hear about many young people who choose not to vote because they don't think the elected officials represent them. How do we energize them? Yeah, you're right. It's something we are seeing. And one of the things that's really frustrating, I think, is that we are seeing that 78% of Virginians support abortion rights. That's massive, right? That's not partisan. So why do we keep electing anti-abortion politicians? And a lot of it is that up until very recently, people did not understand the degree to which their abortion rights were at risk. So they weren't voting based on that. There are a huge amount of pro-choice Republican women in particular who have been voting for anti-abortion politicians. We could see a shift in that, and I hope we do. But we do see a lot more energy for things like ballot initiatives, where it's a direct vote on what you want, not a politician. So how do we energize people? Honestly, a lot of people act like abortion is this controversial issue. It's not as controversial as people think. Compared to political issues, it's not that controversial. And honestly, Planned Parenthood is thought about much more favorably than most politicians, I think possibly all. And that's because of this partisan divide. So I think reminding people constantly that their abortion rights are at risk and that their abortion rights are absolutely on the ballot. And every time they vote, they absolutely need to be thinking about whether or not they want that right. And yes, someone mentioned the other abortion funds around the state. The DC Abortion Fund, RRFP, that's Richmond Reproductive Freedom Project, I believe. HRGL is the Hampton Roads Reproductive Justice League. I'm sorry, I'm terrible at acronyms, so I'm doing my best. And New River, there are a good deal of them. Please do look at your local abortion funds and do support them. It's just incredibly important right now. Any other questions? Awesome. Well, unfortunately, I do have to jump off because I'm actually about to speak about these North Carolina efforts to another group. But thank you so much for having me. I always love speaking with all of my Charlottesville friends. It's always
well, we're so appreciative that you do, and we appreciate all the work you've done here in the past in politics and gotten us all involved. And certainly what you said really means a lot, and I hope will motivate everybody to get to the polls